The reason they didn't know what they were doing was because they didn't understand Emma. They didn't get to know Emma and know what her problems were. But because of Emma's severe learning difficulties, she couldn't explain because she doesn't understand and she just gets frightened. It was when she was 10 months old, she didn't sit up. So I took her back to the health centre and was referred to the child development unit. And there she was diagnosed with cerebral palsy. She stayed there until she was 2. When she was about 6 years old, her feet turned inwards. I went back to the same hospital. They wanted to break her ankles and reset them. I went for a second opinion to another hospital. The gentleman there said that before we started, he didn't think she'd got cerebral palsy. And the brain scan showed that she'd got arrested hydrocephalus. Then Emma was a lot younger, so she was on a children's ward. On the children's ward, they were okay. When she was about 13, I think she started going through puberty. We went back into the original hospital that she was born at to be told that she'd got a cyst on her ovary. By this time, she must have been about 18, and they wanted to put her on Dianet. Now, as they say, Emma, she doesn't react well to medicines. So she went on the Dianet and 3 months later got a deep vein thrombosis in her leg. She was in a lot of pain with it. I took her to A&E and they had a look at her. They said it just must be muscular. I brought her home. She sat on the settee and I just happened to feel her leg, and her leg was rock hard and red hot. And this was 20 minutes after I'd left the hospital. We flew back to the A&E and I went in and it was the same triage nurse. And of course she said to her, "Oh, hello Emma, what are you doing back here?" So, I mean, I was livid. I said, "I'll tell you what she's doing back here. She's got a deep vein thrombosis." What I did was I used to go in the morning and I'd stay there all day with her. And I used to ask, "When's the doctor coming?" Because obviously he needs to speak to me. But they weren't interested in that. As far as they were concerned, I was just a nuisance. And yet I was there all day with Emma. They spoke to Emma as though they would speak to somebody who understood what they were talking about. Emma couldn't tell me. So I didn't know what was going on because the doctor had come when I wasn't there, and Emma couldn't make a decision. And then when I tried to speak to the doctor, I couldn't get one to come. I had to demand in the end that a doctor came down to see me. I just think that even though they were aware of it, they couldn't be bothered. They wanted to do it their way. I went one day back to the ward and she wasn't there. And I said, "Well, where is she? We moved her last night over to another ward." Never rang me, never told me. No, I still went back because you think, well, it's the hospital and you've got to have faith in your hospital because the hospital is actually right on my doorstep. We went back just over 2 years ago and Emma had got a lump in her left side. A junior doctor came to say that the ultrasound was clear and they were discharging her. So I said, "Well, what about this lump?" "What lump?" So I thought, well, I'm not going out of here again, I thought, because they've messed up already. And it was found to be a mass in her bowel and that she'd got diverticular disease. They have got at the moment a total lack of understanding for learning disability, what it means. They have no respect for the carers. They don't understand the knowledge of a carer situation, what it actually means, and especially for somebody like me who's been doing it for 32 years. They don't seem to understand that the patient doesn't understand a word they're saying, so all they do is distress them. So they can tell the patient, but they need to have the carer with the patient at the same time because the patient doesn't understand and all they're doing is frightening them to death. I went to see the ward manager to try and make things better, and she told me that everybody had a special need. So I got nowhere with it at all. Emma had been in there for nearly a week, one tea time, and it was one of the healthcare assistants came and said, would you go and sit in the day room? It's protected tea time. So I said to her, well, I'm Emma's carer and I'm Emma's mother, so, I need to help her with the tea. So she said, yes, but will you go in the day room? So I said, well, no, I'm sorry, but I won't. So with that, she drew the curtains round us. Now that finished me off. I drew them back again. I went out into the corridor and there was a staff nurse there. She said, whatever's the matter? And when I told her, she was falling over herself, apologising. But that's what it was like. I was in such a state after that, it made me ill. I won't go into that hospital again. And I've moved to another hospital and their attitude is just totally different. In the actual A&E department, there is a big notice up and it says that they have got a disability charter and all the staff are trained, and they are, even the cleaners. The way they treated Emma in there, I was part of the team. What I said mattered, and I was made to feel like a person who was worth something as Emma's carer and as Emma's mother. On the ward that she was on, it was a charge nurse. And when he came on duty, he came over to me and he introduced himself and he said, is everything okay? He said, is there anything more we can do for you? Are they doing everything? Are they looking after you? I nearly fell off my chair. I filled in a hospital passport with all Emma's needs, her likes, her dislikes and everything. That was just put in the cupboard at the original hospital. When I went to the hospital that I'm at now, I took this hospital passport with me and that was kept with Emma's notes at the end of her bed. And when we actually left, I forgot it and they sent it me back. But I can go to this hospital now with confidence and I'm treated with respect. Emma is treated with respect. We're all a team, the consultants and everything. And they're lovely with Emma. She'll have a laugh and a joke with them, and she's always asked them what the names are. And it is just a totally different attitude. And I just do not understand why there is such a difference.